Hello, dear listener. Very good morning to you, and welcome to Perspectives, a current affairs discussion program on I Get Radio 95.5 Star from Makurdi, Benue State. Today is Monday, the 8th day of July 2024, and this edition of Perspectives, our focus is on the burden of malaria and cholera in the country. The federal government, through the Ministry of Health and Social Welfare, recently inaugurated a technical a malaria committee, a board, an advisory board on malaria elimination and ministerial task force on the elimination of malaria. According to the World Health Organization, estimates shows that Nigeria had nearly 67 million cases of malaria in 2022, accounting for 27% of the global burden of malaria. Also in 2022, the World Health Organization says Nigeria accounted for 31% of global deaths and 38% of global deaths in children under the age of 5 concerning malaria. While inaugurating the advisory board and ministerial task force, the coordinating Minister of Health and Social Welfare, Professor Mohammed Pati, explained that malaria poses a significant burden on Nigerians in terms of mortality, morbidity, loss of work hours, out-of-pocket expenses, and government investments in the treatment and interventions. Hence, he emphasized the need for the advisory board and the technical committee put in place to tackle the burden more frontally. Nigeria is not grappling with the menace of malaria alone. Cholera is also here on our hands, especially with the flooded environments. It is said that stagnant waters serve as breeding ground for mosquitoes, and now we also have cholera, which the National Center for Disease Control has been reeling out the burden it is assuming on the country. How can these two be frontally addressed in this particular moment that Nigeria is facing the burden? These are the issues we will try to focus on as we give a deep sensitization on this subject matter. I have been joined here in the studio by two medical practitioners who will share their thoughts with us on this subject matter. First, I'd like to welcome the President, Association of Resident Doctors, and a senior registrar in the Department of Family Medicine at the Federal Medical Center, Makurdi. Dr. Fanen Dogoh is our guest on the program. Welcome to Perspectives, Dr. Dogoh.
Thank you very much.
I also have on the program a registrar in the Department of Family Medicine, also at the Federal Medical Center, Makurdi, Dr. Emmanuel Obam. Welcome to Perspectives, Dr. Obam.
Thank you very much. You're welcome.
I am Nathaniel, Nongu, welcoming you to this Monday edition of the program. Perspectives is an audience participatory program. If you are tuning in for the first time, kindly be informed. The program is aired between now and 11 a.m. and usually at 10 o'clock, we open the telephone lines for those listening to call in and also share thoughts with us. You can call in during that time at 10 o'clock on 0814 335 9292. 0814 335 9292. You may send on to 699 9404. Let's also inform you the program is streaming live on all our social media platforms, including Facebook, YouTube, Instagram, as well as X, formerly Twitter. If you follow I Get Radio and TV on these platforms, you'll be sure to join the program live. You may listen to us also by logging onto our website on www.igetradiotv.com to stream the program live. I'd like to begin with you, Dr. Dogoh. What do you make of the federal government establishing an advisory board on malaria elimination and a ministerial task force on the elimination of SAM?
Okay, good morning once again, listeners. I want to also appreciate Mr. Nathaniel for this opportunity. As public health physicians and community family medicine physicians, we look for opportunities like this to educate the public. And I want to, appreciate Agig Radio for always giving us this opportunity and to also encourage you to keep up the good work. Now, first of all, I want to appreciate the Minister of Health, Professor Pate, for this initiative. Now, from the statistics that you read when you started the program, you're trying to introduce the program, you agree with me that malaria is a major problem, especially for those of us in sub-Saharan Africa and Nigeria particularly. So setting up an advisory board that is made up of seasoned specialists in this area who will help the country to look at ways of actually eliminating this problem is a welcome development. And if you look at the people that comprise our board, you agree with me that they are seasoned scientists in their areas. And we are hopeful that they will bring a lot to the table to eliminate this menace once and for all. Now, like you said, the number of deaths that we have from malaria is a source of concern for everybody, both clinicians and the community as well. And the essence of this advisory board is to bring in measures, advice for the health sector and the ministry that will help them to curb this menace. Now, of course, I remember I was here some months ago and we talked extensively on the importance of malaria to public health. And we see that malaria has become a major source. It has always been actually a major source of morbidity and mortality amongst particularly young people, infants, children under 5. So this, I believe, is a welcome development. And I'm hoping that the federal government will stay true to it so that it will help to eliminate this problem that we're facing.
Okay, Dr. Obam, I am with you now. And as we mentioned in our introduction, on the 1st of this month, the coordinating Minister of Health and Social Welfare, Professor Mohammed Pate, did inaugurated 2 boards, one an advisory board and a ministerial task force, all with a mandate of eliminating malaria. What do you make of this development?
Okay. I really want to appreciate Agate Radio for yet an opportunity to sensitize the public about malaria and cholera. Like my colleague just said, it's very, very pertinent to inaugurate that board. And there's a saying that health is wealth. So if you want a country, if you want a nation to grow, either economically and otherwise, you have to take the health of this individual seriously. And just like you read earlier, the statistics you have given pose that there is a huge burden of malaria on especially Nigerians and in sub-Saharan Africa. So there's that need for such board to be inaugurated so that they could advise the government. It also tells us how proactive the government is, because most times when people come down with these illnesses, it's burden on our finances, and of course the workforce of the individuals is also affected, because if you have malaria, you won't be able to go out to do your work, or you won't be able to go out to do 1 or 2 things that will help the country to grow economically. So the government has thought it wise that there's that need for the country to have it at the best in controlling or eliminating malaria. So it's a welcome development that the minister has done, and I pray that they will do their work diligently to achieve their goals and objectives.
Okay, Dr. Dogoh, this is not the first time we are having one of such initiative aimed at tackling malaria in particular. There is a national program on the control of malaria, which has been there. Would you say bringing these 2 boards, an advisory board and a ministerial task force, is an indication that the other programs that have been there have not really been effective in addressing the challenge or burden of malaria?
Okay, well, I would not categorically say that the other programs have not been effective. Please, you agree that to a very large extent, they've done some good work. Of course, you see that in a lot of primary health care centers, anti-malaria drugs are free. This is an initiative of this program as well. In so many, just last year or early this year, the Ministry of Health, Benue, went around sharing mosquito nets, treated nets to people in various places. This is also a function of these programs. Of course, there have also been a lot of health education, promotion on issues that have to do with malaria. This is also part of these programs. And I think these issues have gone a long way to help curb the menace of malaria. So I don't think they have not been effective. They may not have gotten to the point that we would have expected, but I think by and large, something has been done which has gone a long way to help. Now, but I feel that in the wisdom of the minister, he felt that it's good to also bring other people on board to advise. Of course, like you said earlier, this thing came with two aspects. There's the advisory board,
yes,
and then there's the task force.
Absolutely.
And so the advisory board is supposed to bring scientifically based evidence on how to sort out issues that have to do with malaria, and then the task force is put in place to go to town to implement these initiatives. Now, we will only wait and see how much they can do, but we're hoping that they will be successful. We're hoping that they will bring to bear the goals and the objectives of that they were set up. Because sometimes some of these initiatives are brought on board. They are very wonderful initiatives, but the implementation sometimes becomes a problem because of one reason or the other. But we're hoping that this time around we will get it right, because if we do get it right, it's going to help both the social and economic status of even the country. Like my colleague said earlier, you see the economic burden of malaria is huge. If you look at lost man hours, if you look at a lot of things that this has to do it, deaths, mortality, morbidity that arises from this. So we're really hoping that this time around this initiative will work. I think the malaria elimination program has tried, and I think the program is actually still running. So we will just encourage them, to do more, so that we can have a healthy country. Thank you.
Okay, Dr. Obam, are we getting it right in our approach to tackling or addressing the burden of malaria in the country?
Well, I would like to say that we are getting it right, though the results are really not encouraging, though. But then every effort that any government in power puts, at least there's always a positive year to it. But as a country, I think we should actually do more. And how do we do more? A lot of people don't have access to most of these management. For instance, there are people that even up to today, they don't have access to healthcare facilities where they could assess treatment or managing malaria. So it's really, really poor. In a country where we have almost all the wards have come to primary healthcare centers, most of these healthcare centers are not functional. So we should be able to do better and more in terms of provision, in terms of supervision, in terms of ensuring that these facilities are equipped, even with trained staff, to be able to get people to access these services. So it's so appalling when an individual, a lot of people should have access to these healthcare services. Malaria is preventable, it's also treatable. But when you don't have access to all these services, you see that people will die, especially the young ones and those that are immunocompromised. It shouldn't be heard of that a country like Nigeria is still having such a problem. And every year you see a lot of people dying, suffering from malaria, just like the statistics you have given. So the country still needs to do more, and we encourage the government, both at the federal level, both at the state level, as well as the local government level, to ensure that particularly those healthcare facilities are equipped to be able to combat this menace caused by malaria.
Okay, now let's look at the mandate of this task force as well as the advisory board as constituted and inaugurated by the minister. On that day, he did explain that the ministerial task force on elimination of malaria consists of stakeholders from various sectors who have extensive knowledge on malaria implementation in Nigeria and are based in Nigeria. And he went further to say that the task force will ensure that the advice and recommendations from the advisory board are carefully considered, analyzed, and implemented. The task force will collaborate with the Federal Ministry of Health, development partners, donor agencies, and others as a need may be arise. The overall goal of the task force will be to work for the National Malaria Elimination Program, which I mentioned earlier is still in existence, and work to reduce the incidence of malaria. It will also aim to improve the impact of malaria interventions through coordinated efforts in prevention, diagnosis, treatment, and awareness creation. A highlight of some of the duties of this task force. Let's make a talking point on awareness creation. To what extent is there an awareness creation on the burden of malaria from all this?
Okay, now, like you said earlier, the National Malaria Program is actually embedded in the whole activity that the minister carried out, because the essence is to look at ways to, because if you look at the National Malaria Program, if you look at their goals and objectives, they are actually the things that we need to do to eliminate malaria. I think the problem has been the effective implementation. Now, I think that's where the task force comes in. The task force is supposed to ensure that the policies that have been brought up, the aims, the goals, the strategies that have been put in place are followed to the letter. Because if these strategies are followed, to a large extent, we are going to be able to, half the burden of malaria as is the desire of the malaria program. Now, with regards to the health education and information, that's why when we began this program, I really appreciated Ageg with you, because this is one of the ways that you can create awareness about this menace. Now, the thing is, there are a lot of people that actually have malaria. One, they don't even know that what they have is something that can be easily treated. You see, malaria is not something that anybody should be coming down with and dying. It's really painful that you have something that you can easily get treatment for, but because of ignorance, you're not able to do anything about it. That is one. Secondly, the other issues that we have is that because of some of the remote areas, some of these people don't have access to radios, they don't have access to television, they don't have access to the internet, so they don't get information freely. And the local ways that we can inform them by probably doing market meetings, town hall meetings, town criers, those things are not utilized adequately this time around. So many of these people are in these places, they don't have information. They don't know what to do. They don't know where to go. And in some cases, they cannot even go where they ought to go because of bad roads, because of flooding, because of insecurity. So there's a gamut of problems that we're dealing with. But we, irrespective of all these things, we need to still continue to try to see how we can educate the public. I think we need to do more in terms of sensitization, information sharing, education, and promotion. And this we can do in various ways. Like I mentioned, we can do this in churches, we can do it in mosques, we can do it in the marketplace, among market unions, we can do it among even union of road traffic workers, we can do it in town hall meetings. We can do all that to create awareness about this. And I think that's where the task force comes in. We can do that by bringing advertisements on radio, advertisements on TV, so that people get to know, breaking it down to various languages, so that people get to know. I think we need to do more on the information passage, because a lot of people don't have this information. Up to now, I can tell that there are people that don't even know that malaria is treatable. There are people that don't even know that the anti-malaria drugs at primary health care center are supposed to be free. And of course, some people don't know, and if they go to those places, sometimes these drugs are still sold to them. So these are issues that we are contending with. And of course, the issues of insecurity. Some people have been displaced from their homes. They don't even know where to go. They don't know what to do. They are helpless. So they are at the mercy of, so many things. So these are some of the areas that if they are tackled, I think even in terms of information, it can reach some of these unreached groups, some of these people that stay in remote areas. Because if you look at the burden of malaria, you discover that most times it is worse around areas that are congested, areas that are unkept, rural areas where there's a lot of grass, bush, and all that. So these are some of the people that need this information. Of course, those of us that have access to TV, have access to radio, have access to the internet, and are willing to read, get some of this information. But those who don't have access to these things, they are the ones that are worst hit. And then, of course, there is the area of misconceptions, cultural practices that sometimes tend to hinder people from accessing or using the knowledge that they have. So you can imagine somebody comes down with malaria, which can be easily treatable, and then they're telling him that it's a spiritual attack, or they're telling him that it's something that cannot be treated. There's a lot of misconception here and there. They are telling him that he has to mix one concussion. These are things that we have to also try to correct some of these cultural notions amongst our people.
Okay, Dr. Obam, in terms of awareness creation to aim at preventing malaria, what best strategies could be deployed in terms of health education or health communication, especially at the rural communities?
Okay. Just like my colleague said, health education and creating awareness is very, very important to preventing malaria diseases, and it's very key because if someone is aware that there is malaria and this is how to handle it, you have solved more than half of this person's problems. Of course, it's always difficult to pass this information to the rural areas. It could either be due to security reasons, it could either be due to bad roads, and of course, it's always difficult to get to the hinterlands, especially in the modern Nigeria that we have now. But be that as it may, it is still very, very pertinent that we approach them and give them this vital information that they need, because a lot of them are suffering, honestly. It's only when you get to those places that you will know that people die from malaria, especially the children and the pregnant women. So it's always good for us to pass this information to, like town hall meetings. Of course, when it comes to political outing, people get to those places to at least seek for people's vote. So I think if that strength is also used in passing this information, it will help a lot, because during campaign people get to those places that are very, very difficult to access even on a normal day. But then for information that is very vital for these persons, why can't we get it along to them? So it still boils down on the government to at least ensure that this information gets to that place. For instance, if health education should be done in town hall meetings, in churches, in gatherings, in schools, and youthful organizations, the government, don't stop the government from sponsoring such events. Nothing stop the government from saying, okay, let's go to this place with security, with available vehicles and logistics and all this support that they need to ensure that this information gets to those persons. So since it's very key, I think the government should be able to do this at every time, so that people will have this information, because information is vital. If you don't have this information, you will continue to suffer for it, for what is actually curable. So since we know that this information, this awareness have already given us some percentage of prevention and treatment, it's better we go into it. So that's what I feel should be done by the government.
Okay, dear listener, you may just be tuning in. The program is Perspectives on Agate Radio 95.5 Star FM Makurdi. We are discussing the burden of malaria and cholera in the country. And I have here in the studio two medical practitioners that are driving the conversation. The President Association of Resident Doctors and Senior Registrar in the Department of Family Medicine at the Federal Medical Center, Makurdi. Dr. Fanen Dogoh is here with us. I also have another registrar. They are leading us on the conversation. You too can participate later at 10 o'clock by calling in on 0814-335-9292. 0814 335 9292. In the meantime, the line for text messages and WhatsApp chats is already activated, and that line is 0812 699 9404. 0912 699 9404. If you are sending a message or a chat, kindly remember to include your name and where you are sending your message from. It may be a question we could address it as well. You may log on to our website on www.igetradiotv.com to listen to the program live. And also, if you have your Radio Garden app on any device at all, you may listen to iGet Radio there. And all our social media platforms, including Facebook, YouTube, X, formerly Twitter, as well as Instagram. If you log on to these platforms, you'll be sure to listen to us and follow the live stream of the program. You may drop your comments on the links, and we may take them if they are related to the conversation we are having here. Dr. Dogoh, in terms of diagnosis, the past part of the awareness we are raising here now, what are the best ways to diagnose malaria and what are its symptoms? Let's break it into the basic components so that people get to understand us.
Okay. Diagnosis of malaria, like you rightly pointed out, has to do with what we call the history, the clinical features, and then of course the laboratory investigation. Now, there are things that we want the fact that this person has malaria, and what are they? First of all, for the clinical features, you see somebody who maybe for the history lives around a place that is swampy, lives around a place where there is open refuse dumping, lives around an area that has this open defecation, lives around a place that is bushy. This person is already at risk of coming down with malaria. So from the history, those are the kind of people that you will likely find coming down with malaria. Now, also the other places are congested. Now, for the clinical features, somebody who you notice that your body is hot, as we say it, you have a fever, your temperature is high, it could be a pointer that you could be having malaria, or you start having a headache. You start having headache, it should be a point. Sometimes you may start having abdominal pains, you may start having waist pain. This could be pointers that you may be having malaria. You may be having joint pains, pains in your joints. You may be having a general body weakness, you are just feeling sick. That could be a pointer that you may be having malaria. Now, for the laboratory diagnosis, there's what we call the rapid diagnostic testing, and they will have microscopy. The major way that we diagnose malaria is through the microscopy. However, the rapid diagnostic test has also been recommended from the national guideline that we can use. It's a very easy test to do. Just take a little of your blood, put into the kit, and then use a buffer, and then it shows whether it's positive or it's negative. So especially if the parasite burden is high, and then of course we have the microscopy which we do in the lab. So these are ways that we can diagnose malaria easily. Because the reason why it is important that we do the laboratory test as well is that some of these symptoms can also be present in other illnesses. So it's not only malaria that can make you to have a headache, for instance. It's not only malaria that will make you to have a fever. It's not only malaria that will make you to have joint pains. You remember during the time of COVID, the symptoms of COVID were actually even similar to some of the symptoms of malaria. So it's important that, from the national guideline, it's important that we do fever, start having joint pains, start feeling sick. It's good that you go, to have a malaria test, and if it's positive, you get treatment immediately. For those that are in, areas where we have primary health care centers, I want to repeat again that some of these medications have been subsidized or even free, especially for pregnant women. And in pregnant women, it is very, very important because malaria is a major cause of morbidity and mortality in pregnant women and in children. So we shouldn't take it for granted at all. You may see a child that just has having a fever. Within the next few days, it becomes very severe because nothing was done about it. So once you notice that your child is having a fever, maybe he's complaining of abdominal pains, he's complaining of body pains, maybe he starts even vomiting, or he cannot eat or doesn't feel like eating again, it's important that you check. Thank you.
Okay, Dr. Obam, is there something you would like to add to this to give us more insights into uh, symptoms and diagnosis of malaria?
Okay. Yeah, my colleague has been exhaustive actually, but then the mistake most persons have or do is that once the individual has come with these symptoms, fever, loss of appetite, weakness, and they are suspecting malaria, they just give anti-malaria drugs. So most times, a lot of healthcare workers treat those that are not even positive for malaria. So it's always advisable that testing is done, because it will now tell you that yes, this person qualifies for anti-malaria medication. In as much as in a place where this might not be available, the laboratory testing might not be available. Of course, it could have a high index of suspicion, and of course the clinical judgment of this health worker will be able to guide the person to treating malaria. Of course, it's always better to treat it when it's not complicated. Once these symptoms are felt, it's always important that the individuals go for testing so that it will be treated appropriately. Let the person not develop severe symptoms again, because at that point it will be a burden. It's always advisable to go to the hospital. Most times people in this part of the world feel that disease is not the kill Africa. They will just stay at home and be managing, or trying to see if they'll be able to come out of it. But it's not advisable. Once you are not feeling fine, it's always advisable to go to the hospital, especially the children and the pregnant women. Once you have this symptom, it's always good to go to the hospital.
You both have emphasized children and pregnant women. It means, are they the categories of persons who are more vulnerable to coming down with malaria, or it cuts across all categories of persons? Dr. Dogoh.
Yes, the malaria affects all categories of persons. It affects even elderly people, affects young people, middle-aged. But those that are worst hit are children and pregnant women. In fact, infants, children under 5 are the worst hit. If you look at the statistics, most malaria deaths occur in these individuals. They are also the ones, and then those that are immunocompromised. Those are the people, and by immunocompromised, I mean people that may be having some cancers, people that may be down with some illnesses like HIV, people that may be diabetic, So these individuals may be worse hit. Of course, in children, because one, their immune system is not yet very strong, so they come down more easily with this problem. So it is important that it's taken very seriously in them. An adult can have malaria symptoms and he's still going about his normal business because maybe he's strong, even though he's feeling somehow weak, he's still going about his business. Maybe after some time he now breaks down. But for a child, it's not like that. A child comes down with malaria within 2 days, 3 days. If nothing is done, it can become a severe case. Same with pregnant women, because malaria can cause miscarriage. Malaria can cause, death, outright death. Malaria can cause a lot of problems, especially in women. It can even affect the baby. That's why we have some people who call congenital malaria. So we don't take it lightly at all in this category of person. That is why at this point I also want to encourage that when you take in, it's important that you go for antenatal care as a pregnant woman, because during the antenatal care you receive what is called intermittent preventive therapy, malaria prophylaxis, that is given against this malaria to boost your immunity against malaria. It's very important, because if you come down with it before it has to be treated, it may become a bit complicated. So those are the category of people that are worst hit, and that is why you can see that we have been emphasizing children, pregnant women. It doesn't mean it does not affect other people. It affects others as well.
Because I was going to say, thank God I'm no longer in charge.
No. It can affect you as well.
It's okay. Dr. Obam,
Yes.
you wish to add something to that?
Yes.
Very briefly?
Yes, particularly the immunity of the individual is what is most important, because you need to fight this illness. So your body is equipped to actually fight this illness. But when that function is lowered. He finds it very difficult. And mostly, like he said, the children, they have a very naive immunity that is not yet matured. So they are easily affected. And then pregnant state is also a state that lowers immunity in this individual. So it's always that's why most times the preventive measures are mostly targeted on this individual, so that they wouldn't come down easily having this infection. So the emphasis is on the immunity, because these people the immune state are lower. That is why we are emphasizing on children, pregnant women, like he added, the elderly ones too, those that are immunocompromised too. Those ones also fall in that category. So it's always advisable that those set of persons are watched carefully. Thank you.
Okay, Dr. Dogoh, we are going to marry this conversation, malaria and cholera, as we go along, because the two are oftentimes tied to disease of public importance that are associated with issues about sanitation. We have cholera on our hands now, ravaging the country. What are the preventive measures people need to adapt, particularly at this time that the burden of malaria is there and now cholera is here that we are grappling with?
Thank you very much, Mr. Nathaniel, for that question. I was actually waiting for you to ask, because in all our conversations here, the prevention is the major issue.
Absolutely.
Because these disease conditions are conditions that can be completely prevented. So you have somebody that can live without having cholera at all. So if you have a situation where you can avoid having something, it's better to avoid it, so that you don't spend any money on it, or you're not stressed about it or whatever. Now, that is why these programs are very important. Now, in terms of prevention, prevention is at different levels. Prevention is at the level of, starts from the level of government. Now, what do I mean by starts from the level of government? Now, we're talking about, let me marry it to malaria and cholera. Now, we have a situation on our hands where we have cholera in certain states in Nigeria now. Luckily for us, we've not recorded, as at this morning, except if there's a new information, we've not recorded any deaths from cholera in Benue yet. Hopefully, we will not. Now, measures first have to do what we call the primordial prevention, and that is where you have policies of government. Policies of government to avoid us coming in contact with the risk of developing those diseases at all. And what are these policies that government can make? One of the policies I think have been adopted by the government of Benin State, which is applaudable, is environmental sanitation. I think it's every last Saturday of the month or so. Or is it first Saturday of the month now? First Saturday of the month. There is environmental sanitation. It is mandatory for everybody that between morning and 10 a.m. you don't go out, you stay at home and clean your environment, except for essential workers, which is a very good way of prevention, because by the time people are made to clean their surroundings, make sure that there's no blocked gutters, there are no bushes around, there is no open refuse dumping. And of course, the other day I saw, is it Bensasa or some these people cleaning the environment. These are things that we encourage government to do. That's the first level of promotion. Ensure that marketplaces are cleaned daily. People don't drop refuse after you finish selling oranges, mangoes, spoiled leather bags. They should be cleared on a regular basis. Bushes should be cleared at homes, in public places. And there was a policy recently that people should stop farming within government areas, because these are some of the clearing of government places, clearing of homes where there's a lot of grass and bushes. These are breeding places for malaria. Clearing of stagnant water. These are things that can be put in policy. Now, that is at the level of government. Of course, at the primary level where we are trying to, now that these things are there, what do we do? Environmental sanitation. Now, environmental sanitation is very important both for malaria and cholera, because one of the major cause of cholera is contamination of food and water. Now, primordial prevention comes in there because government's responsibility is to provide potable water for people to take. Now, if people don't have access to good potable water and they are made to go to, stagnant water, streams, where these places could be breeding places for the cholera bacteria, if they are more exposed and they have risk of coming down with cholera. So, again, preparation of food, the government should be able to make policies that they are able to monitor people that sell, especially public food vendors. The way this food is prepared, the way this food is served, these are things of policy. And then when these things are put in place, it helps to safeguard against coming down with these things. The other issue is the issue of the way we prepare our own food as well at home. Personal hygiene is very important. You should ensure that your hands are always washed with soap and water before you start preparing your food. You should ensure that the water you are drinking is clean. Now, of course, with the economic situation we have, some people cannot even afford to even get clean potable water anymore. So they resort to maybe well, go to stream and fetch. Yes, you may get that, but one of the ways you can keep this clean is to boil the water. So you boil the water, then allow it to cool, and then you can drink it. That boiling kills the bacteria, Or the other way is to chlorinate your water. There's this chlorination you can do to preserve the water to free of some of these bacteria. So these are some of the things that we can do as individuals to ensure that we avoid coming down with these things. And then, of course, for the malaria aspect in prevention, we have, apart from the environmental sanitation and cleanliness, you should ensure that there are nets on your windows. If you can afford to put nets on your windows, is very important. Then the use of insecticide-treated net, we will continue to emphasize that, because these nets, to a large extent, have been made available to a lot of people. These nets are not supposed to be used to be putting in farms. They're not supposed to be used to be using as football nets to be playing football on the pitch. They're supposed to be used in the rooms when you sleep under this mosquito net. It helps to protect against mosquito bite at night. Then we should ensure that we put coverings, clothing that will cover our hands, our legs when we are out in the night. This will also prevent us from coming in contact with mosquito bites. And then the use of insecticides can also go a long way to help us with prevention against these mosquitoes. So I think I will leave at that so that my colleague can also add some other things.
Okay, Dr. Obam.
Yeah.
We now have you to share your thoughts with us on preventive measures, particularly for cholera and malaria, as given it is being tied to sanitation, personal hygiene, and all these factors.
All right, thank you. Like my colleague did say, is pertinent that government enact policy that will help the individuals, of which he said is the primordial aspect of prevention. And he's been able to combine the primordial, primary, secondary, even up to tertiary part of or level of prevention. So the government is very, very key to preventing most of these diseases. Like he made mention to housing. Housing is very, very important. In a situation where people lump themselves without drainages, without spacing, the government could only help, in providing housing for these individuals. And again, it boils down to the individual, particularly in preventing cholera. They always tell people to wash your hands before eating food, before taking anything. Most times, people don't really understand what it means to wash your hands. If they say wash your hand and a bowl of water is brought, and you just wash and maybe a meal is to be consumed, and that bowl of water is the same water that everybody is using to wash their hands, you have not done justice to washing of hands. It's always said, wash your hands with running water. The water should be run. That is, if you don't have a tap in your house, you should have someone that will pour you water as you wash your hands, so that whatever is coming down is poured away. Not that one person will wash his hand in one bowl, the same another person does the same thing, another person does the same thing, and they are going to eat the same meal. It's not advisable. Even if you are the one eating this meal alone, it's advisable that you use running water to wash your hands. It's okay. Then, of course, people pick a lot of meals and eat without taking cognizance of washing them. For instance, fruits like mangoes, cashew nuts, cashews and the rest. A lot of people just pick it by the roadside and eat without washing it. It's not advisable, because most persons that come down with this cholera actually maybe might have been infected this fruit. So it's always advisable that fruits are washed. If you need to peel them, peel the outer cover, it's always advisable to peel them before consumption. Then there are some persons that eat uncooked meals too, or meat or seafoods. It's always advisable to make this, to at least allow these meals to be cooked. So it boils down to the individual, just like in addition to what my colleague had said, sanitation, cleanliness, environmental sanitation, personal hygiene, personal cleanliness is very, very key to preventing these two diseases. Thank you.
Okay, Dr. Dogoh. Most of what we may have highlighted here, some of it may seem like we're speaking to the everyday town person. In the rural communities in particular, what kind of strategies people need to adopt to tame the burden of malaria and, of course, cholera that we have been hearing about the results of? The records and statistics are shown by the National Center for Disease Control is showing how the concern is growing in the rural communities.
Okay, thank you very much. Now, the strategies are not so different in terms of the individual, because whether you are staying in an urban area or you are staying in the rural area, wherever you are staying, the issue of personal hygiene is sacrosanct. And by sacrosanct, I mean it's an issue that nobody can push aside. It means that whether you are in a village or you are in the town or you are in town, you should ensure to keep personal hygiene. Now, of course, in the villages, because maybe there's lack of power, they may are prone to be probably staying more around maybe bushes. Maybe they don't have enough potable water, so they may be more at risk of coming down some of these things. And then because some of the villages, especially in the tea-speaking areas, they tend to live a communal life. You see, a lot of tea people, they eat together, unlike what you may find in some cultures. So the issues become a bit more complex because, like you said, imagine, and this is something that we do commonly everywhere. The issue of just the same book is something we do commonly. I don't know for other tribes or cultures, but I know that in where I come from, it's a very common practice. Yeah. It's a very common practice. So these are things that if we can educate our people about, and these ways, imagine somebody goes to the toilet, has cholera. He doesn't even know, because you can have cholera for a week. You don't even know. You become a carrier. Has cholera, doesn't know that he has cholera, cleans himself up, doesn't wash his hand properly, now comes to eat food with you. He washes his hand, they pass the bowl to you, you wash your hand, then you people start eating. It's going to affect the whole house easily. So it still boils down to the personal and environmental hygiene, and we have outlined them. Now you see, it's important. There are some issues he mentioned I think are very, very important, especially for cholera. Ensuring that meals, irrespective of the kind of meal, is well cooked. Ensuring that fruits, vegetables are thoroughly washed. Wash them thoroughly before you eat them. Don't just carry something and start eating. Make sure it is thoroughly washed. I know sometimes if somebody just carries, let's say mango, carries a handkerchief, cleans it, and then starts eating. Those kind of things are what can make this disease to transmit easily. Then, of course, like I spoke about the issue of malaria. You see, some of these people may not have even the finances to buy things like insecticide sprays. And I understand that the Ministry of Health has shared some mosquito nets to these people. Those that have access to these nets should ensure to use them. Because if you go to some of our villages now, these nets are used in farms. They use it to cover, I don't know the technology behind that. They use it to cover, their vegetables. They use it to cover.
Perhaps so that mosquitoes will not go the
vegetable. You understand? So this net, because that is the easiest way to protect. Use this mosquito net and then ensure that your environment is clean. Ensure that you don't have stagnant waters around. If you have to get water from a stream or from a well or even a stagnant pool, if you can't get potable water, then you can boil this water. If this water is boiled and steamed, to a large extent, it takes care of some of these bacteria, so you don't have to come down reason. So I think basically is eventually apart from the the government part of it, where we expect that the government should be able to make adequate provisions for a healthy living for these people, like we outlined earlier. It still comes down to personal and environmental sanitation, irrespective of your location. Thank you.
In fact, when you mentioned the concern of stagnant water, especially now that we have flood
Yes.
in urban centers, there are certain locations that stagnant waters are standing, serving also as a breeding ground for mosquitoes. It's called for serious concern. Anyway, we'll go along. Dear listener, the line through which you can reach us minutes away, it will be opened. You can call in on 0814-335-9292. 0814-335-9292. That's the line to participate on the program. Send us a text message or a chat to 0912-699-9404. 0912-699-9404. Also log on to our website on www.agetradiotv.com to listen to us live. Also, if you have your Radio Garden app on any device at all, you may listen to Agate Radio there. Follow all our social media channels, Facebook, YouTube, X, formerly Twitter, as well as Instagram, and all other social media platforms. Where there to serve you, and your health is our concern. That is why on this edition of Perspectives, we are focusing on the burden of malaria and cholera. And I hope as you listen, you get to learn something on how to keep yourself healthy. Dr. Obam, the National Center for Disease Control has been enlightening Nigerians, giving periodic updates on the burden of cholera. But if I'm hearing from you, as you may have presented, that no death is recorded. I don't know if in the health institution where you work, you have had cases reported or suspected cases yet. Perhaps you want to help us share such information, Dr. Obam.
Okay, like our own facility, I've not heard of any suspected case yet, but the statistic that was rolled out by NCDC, at least Benue State, they have about 6 suspected cases there, but no death has been recorded yet. So I've not heard of any in my own facility. Yeah.
Okay, Dr. Dogoh, do you have such information?
As of this morning, when I checked, Benue has recorded 6 cases, like he said. So the cases are beginning to dwindle a bit. If you look at the curve, it's going down. So hopefully we are winning. But that is not to say we need to relent. We've had cases of cholera before in Benue State. And then, of course, this is a period where you have these cases coming up, this rainy season, where there is flooding, there's a lot of stagnant water here and there, Then, of course, when people that stay areas where there is no adequate sewage system, so by the time somebody uses the toilet and then there's a flood and it carries this, so this is a period, and we need to still be on alert, because cholera is a disease condition that if you suspect in one person, it goes up to WHO. So if I find a suspected case of cholera in my facilities here in Makurdi, I will inform the local government will inform the state government will inform the national will inform WHO. So that's how serious cholera is, because any disease condition that is something that is preventable, and not just that is preventable, has the chance of easily affecting other people around you. Because if somebody gets cholera here now, and it is not quickly addressed, before you know it, almost everybody around there is going to have it, because it's a highly contagious condition, and then because it has a high mortality rate, there's a high death rate, especially amongst children, if it's not quickly tackled. And why is that? Because we didn't even mention some of the symptoms of cholera. One of the symptoms.
Yes, but maybe let's give free to share.
Some of the symptoms, and one of the reasons why you see that it affects people so rapidly, is because once you come down with it, you start having diarrhea. That is passage of loose stool, and it becomes so much. It's so much that within 24 hours you can lose a lot of fluid from your body. And these people get completely tired, dehydrated. And of course, in some cases, you are even vomiting. And when it comes to children that have a very small body mass, by the time a child loses that amount of fluid, before you know it, he is not able to do anything again. He begins to lose electrolytes, and he becomes so sick. And this is because you are dealing with things that people take water almost every other minute. People are taking water. People eat food every day. So it's something that people are consuming water and food every time. So if it spreads, it can easily spread, because maybe I just finished eating, and the next 10 minutes another person is eating. Before you know, the water I'm drinking, another person is drinking it from the same source. And before you know, people come down with it. So it's something that we take very seriously once it is identified. And I believe that the Ministry of Health, even in Benue State, is on the lookout for any of those, kind of cases, because these are issues that anything that is something that can be treated and prevented, we like to tackle it headlong, so that it doesn't even arise at all. Thank you.
Okay, people may be wondering that this malaria, cholera, is there a vaccine about it? Because oftentimes when we hear of these concerns, Nigerians wonder, why is it that we still have it recurring again and again, and we're not finding solutions to addressing it? Is it vaccine preventable? When we say all these are preventable, is there a vaccine that takes care of that, Dr. Obam?
Yes, like we earlier said, at the level of the primary level of prevention, vaccination is implicated in that level. So there are vaccines for preventing cholera and, of course, malaria. But then in malaria's case, I don't think Nigeria have access to that yet. But then for cholera, there is, think about 2 vaccines, Ducora and Shinko. That's the name of the vaccine that is being used. So they are available. They are vaccine preventable. This is just like we earlier said. The government always want to ensure that preventive measures are better. And if an individual is vaccinated against these diseases, of course, it gives you more stand against this disease. But the availability, like the malaria, is what actually is causing a lot of problem. But then the preventive measures are there for everybody to do. Even as much as you don't have access to this vaccine, the preventive measures are as well good measures for you to combat or prevent these illnesses. Just like we said earlier, sanitation, personal hygiene, clearing of bushes around the houses, draining of stagnant waters like that, and of course washing of hands, properly cooked meal are enough to prevent these diseases from affecting us. Thank you.
Okay, let's engage with those listening to us. Hello, good morning and welcome to Perspectives.
Yes, hello, good morning.
Yes, welcome to Perspectives.
Yes, Ibu calling from Ghetto Villa at the moment.
Okay, Bidutenenge, thank you. Go ahead.
Yes, I want to be more of like an advice to my chief, Dr. Dogoh. If you look at most of the hospitals, if you go to call room, nursing stations, and the ward, the amount of mosquitoes you see there is as if those ones are different species, as if they are gymming. Very, very big. So I would like to equally tell him that most of the hospital environment should be because of the mosquitoes that are there.
Yes.
Nurses cannot stay comfortably in nursing stations because of mosquitoes, and equally the ward. So I will appeal to him to talk to ARD, where insecticide should be provided often. And again, more of like an advice to the vice chancellors of any head of institutions. Go to our hostels, go to where students stay. Mosquitoes that are there are very, very, very plenty and much. So I will equally advise we should increase the level of fumigation. So that is my little contribution.
Thank you for your contribution, Ibidutenenge. We appreciate you. Ibidutenenge is not just interested in only the mosquitoes in the homes, but also those in the hospitals, and he wants the doctors to be safe.
Can I say something?
We'll go along. We'll get to comment later on.
Hello, good morning.
Morning to you, and welcome to the program.
Yeah, my name is Usman Abu. I'm calling from North Bank.
All right, good to have you on Perspectives, Usman Abu.
Please, my own is a question. Is it that I want to ask whether if there is any other thing that causes malaria apart from this mosquito? And secondly, the one of cholera, whether if there is any anti-cholera drugs that one can take if he has the symptoms before assessing the clinic. That's my question.
Okay, Usman Abu, thank you very much. We'll respond to your question as we go along. The line is open 0814-335-9292. Let's engage with, okay, Dr. Dr. Dogoh, you were itching to say something to Igbudutenege.
Well, no, I just wanted to appreciate him for the input.
Yes.
Because I think what he said is very, very, very critical. When we talk about some of these issues, it's not like we are leaving out even the hospital environment or doctors, or health workers, let me say health workers, because health workers are also in the same environment. So these issues apply to all of us. And like he said, as a union, because he's particularly called out by a union. So as a union, these are some of the issues that we try to engage the management about, ensuring that the hospital space, it is not good that somebody comes to the hospital for a different illness and comes down with malaria in the hospital. I mean, it's not good. Yes. So I want to say that his advice is valid, and that the hospital environment should also be kept clean and environmentally okay. For these illnesses.
All right, well, let's go along. Hello, good morning.
Hello, good morning.
Welcome to the program.
Yeah, my name is Ifanyok. I'm calling from Barras Road.
All right, Ifanyok.
Yeah. My question is like this. Is there any way to prevent this malaria? Because when I was a kid, I used to hear about malaria fever. Even up to now that I am above 40. So, is there any way that someone can prevent it?
Okay.
That's my question.
Ifanyokpa, are you just tuning in, or you started listening to us at the beginning?
I'm just tuning in.
Oh, okay. We'll just do a refresher. Otherwise, we have spoken about that very extensively. But thank you. We'll do a refresher as you listen, you will learn more. Thank you. All right. Thank you very much, Ifani. Okay, Dr. Obam.
Okay.
Usman Abu is asking us, apart from malaria, mosquitoes, is there any other thing that causes malaria? And the vaccine for cholera, where can he get it? Let's get to respond to Usman Abu.
Okay. Like briefly, in addition to what my colleague said about the hospital environment, actually is a call for concern, and it still boils down to policy, supervision, and the involvement of the government of the day, especially in seeing that health facilities are okay. Honestly, the government should be able to do more on our health facilities. Then on the causes of malaria. Malaria is a parasitic infection that is caused by Plasmodium species. There are different species of Plasmodium that cause malaria. Can be oval, can be vivax, can be malariae, can be falciparum or knowlesi. But the one that is common in our environment is the falciparum, and is the one that is also implicated with severe malaria too as well. So it's caused by that. But then how it's transmitted is through the bite of an infected female Anopheles mosquito. So it's only someone who is bitten with that infected mosquito. There are a lot of mosquitoes, but it's restricted to that species, female Anopheles mosquito. So it's possible that you might have all those big mosquitoes, either male mosquito, Aedes aegypti. There are different types of species of mosquito. But then there are other ways that individuals too could come down with malaria, just like he had mentioned earlier. Can be through the placenta. That is a pregnant woman giving to a fetus in the womb. That is congenital malaria. Also, if an individual's blood is infected with malaria parasite and is transfused to another person too, the individual too could also have malaria. So these are the various ways that one can come down with malaria. For anti-cholera drug, well, apart from the vaccination that we said, these vaccines are not an individual who comes down with cholera, you present, like he said earlier, presents with copious diarrhea, vomiting, it could be dehydration, which should be mild, moderate, or severe. The important thing for one to do initially is to take an oral rehydration therapy. That is the most important thing that one could. And healthcare centers too, you could access them, and it's not that expensive. And preparing it is too not difficult too. So once an individual comes down with cholera, or once someone is passing loose too or having diarrhea, it's always advisable for that initial treatment before the individual is taken to the hospital. Of course, in the hospital, there are so many things that are supposed to be done, so many investigations that are supposed to be done. And of course, in the hospital too, antibiotics too, because this cholera too is a bacterial infection. So antibiotics can also be given against that bacterium, which a health personnel could also give. So basically, these are the ways cholera can be handled.
Okay, Dr. Dogoh, is there something you would like to add to that?
Well, basically,
So we get to educate Usman Abu, and maybe a refresher. If Anyopa is listening as we go along, just a refresher. Briefly.
okay. So basically, I know that when we talk about illnesses that have become a turn, so to say, the people's flesh, they just feel there's something that we can do to just do away with it and let everybody move on with their lives. But the good thing about these issues we're discussing, malaria and cholera, is that there are things that we can prevent. So rather than waiting for it to come, that we can take a drug or something, it's better to just do the necessary things we need to do to prevent coming down with it at all, and the things we can actually do if you are committed to it. So basically, like he said, it's malaria that is the cause. That's what causes cholera. So I don't want to go over it again because of our time. But to do a refresher for Ifeanyi, who just joined late, we have been talking about malaria and cholera. And we established the burden of the disease. We established its public health importance, how it is a major cause of death and morbidity, in our environment. And then we try to outline some of the causes, the symptoms, the clinical features, and then some of the ways that we can diagnose. Now, we said that for malaria, it may present as a fever, as headache, as abdominal pain, joint pains, loss of appetite, waist pain, and general body weakness. These are some of the ways that it can present. And we said for somebody who has these symptoms, it's better to go and do a test to confirm if it is malaria and then to get treatment. And then we talked about cholera. We said it usually will present as copious passage of loose stool, copious diarrhea, and in some cases the patient may also be vomiting, and the patient may be severely dehydrated and tired and lethargic. These are some of the ways that it can present. So if you see anybody in your environment that is purging, it's important that you take this person to a near community that even first raises an alarm that we are seeing something like this. So it's important that we know some of those danger signs, so that when we see them, we can raise an alarm, and then the right thing is done. Then we talked about some of the preventive measures, and we talked about importantly, environmental and personal hygiene and sanitation. So environmental sanitation, we talked about clearing of bushes, talked about clearing stagnant waters. We talked about ensuring that there's availability of potable water and adequate food preparation measures, like proper washing of hands, boiling of food to be properly cooked, washing of vegetables and fruits, and all that. So these are just a summary of the things that we'll discuss for Ifeanyi that just joining us. Thank you.
Okay, Ifeanyi, so if you are listening to us, we hope you have learned something more. You say you are 40, but you don't know the prevention of malaria. We'll go along, you will get to learn more. That is why this program is put together, so that every one of us is sensitized. Dr. Obam, I'll request you to speak to us on the management of malaria in terms of drug administration. Your colleague made a submission on how anti-malaria drugs in primary healthcare centers are meant to be free. But do we have them available, and are they actually being dispensed to patients free of charge?
Okay, in treating malaria, anti-malaria medications are used. The recommended drugs in the national guidelines are antihistamine-based combination therapy. Those are the drugs requirement for managing.
Perhaps let me interrupt you briefly. Several calls have been waiting on the line. Let's engage with a few.
Hello.
Then we'll come back. Good morning.
Hello.
Hello. Good morning.
Good morning.
Good to have you on the program.
Yes, I'm Vincent calling from Bankmat.
Okay, Kwaza Vincent, please make your submission.
Yes, I have a question.
Yes.
See, when having a fever or a child is having a body temperature, the high body temperature, and you go to the chemist, what they normally tell you is malaria. And then you start treating this child based on that malaria. You buy the drugs for this malaria. And at the end, you discover that this treatment you are giving is not enough. What will happen to that particular treatment that you have done to that child or that person? What will happen if you are treating malaria, you are giving the child malaria drug, and you discover that that sickness is not malaria? What will happen to the child or the person?
Okay. After in such a situation, you carried out a diagnosis already? Did you do a test before commencing the treatment, Kwaza?
No, you have not done it before. Maybe once you go, you are having a body high temperature, you go to chemist, you explain to them, they will tell you that it's malaria that is disturbing you. And then you start the treatment. At the end, you discover that it's not that malaria. Then what will happen to the malaria drug you have already taken?
Okay, thank you. The doctors will speak to that. Thank you, Kwaza, for raising your poser. Okay. And thankfully, the question aligns with the semi-short drug. So as you go along, you listen to him carefully. So you expand on that too. Dr. Obam, continue your thoughts.
Yeah, those drugs are meant to be available at the primary healthcare level or in the facilities and are supposed to be dispensed freely to individuals. Of course, there are times that you will go to those places and they get exhausted, they are not available. But then, of course, like we said earlier, it still boils down to the activeness and proactiveness of the government to ensure that supervisions are always at every level. Because once there is supervision and you are supposed to be out of this stock in the next 1 week or to 1 month, you should be able to make demand depending on how it takes for these supplies to come. So strictly for malaria, anti-malarials are given, and it's artemisinin-based combined therapy. There are different of them. It's not just one. It can be artemether-lumefantrine, can be artesunate amodiaquine, can be. There are a lot of them. So once you get to the facility, the one that is available at the discretion of the health practitioner is given. Then for the question the last speaker just asked, of course, a lot of things happening in Nigeria are not supposed to happen, because if you compare the health-seeking behavior in these parts of the world to other countries, discover that there are a lot of things that are happening in Nigeria that ordinarily are not supposed to. Because you don't just go to a chemist, or even pharmacy and say, I'm having fever, and whoever is there prescribes drugs for you. It's not supposed to be like that. The doctor should be the one to prescribe before the pharmacist dispense these drugs. So for any case where an individual gets to the chemist or to the pharmacy with symptoms when not properly managed or diagnosed, of course you always have those issues. And like my colleague said earlier, there are certain illnesses that might present with similar symptoms. It's not that the fever is only for malaria. There are so many things that can also cause fever. It could be a lot of enteric fever. A lot of things could also cause fever. So is the knowledge that the doctor has. The doctor is taught, on how to make his diagnosis, either using history, clinical features, examination, and of course laboratory investigation. So it's always advisable that once someone is ill, you get to see the doctor. The doctor will examine, the doctor will investigate and prescribe before you go to the pharmacy to get your medication. But in this part of the world, it's not like that. Once I have abdominal pain, once I have headache, straight up to the pharmacy, to the chemist, and of whoever is there, whether a pharmacist or a chew or a nurse, you see them prescribing drugs for all. These are bad practices. They are not good. So they should be discouraged. Individuals should be able to access at least a primary healthcare center that is close to our abode. Thank you.
Okay, so I think Kwaza may have wanted to hear that perhaps the drugs malaria taken already will serve for a booster against future malaria, but that is not the case. Okay, Dr. Dogoh, in terms of drugs, malaria drugs, drugs have assumed an astronomical hike in price now.
Yeah.
The burden is an issue in its own entirely. Maybe we'll focus on that in another edition. But you mentioned earlier about anti-malaria drugs in particular, which are meant to be dispensary. Do we actually have them free? Are they subsidized? Are they available in the health centers to be dispensed to people free of charge?
Okay, thank you for the question. Now you see, the economic situation usually affects every aspect of human life. So if you have a situation where there is a lot of inflation, as you find in our country for a while now, it's going to affect even the health, because there's some people that are sick. They know that they should be in the hospital. They have good roads, so to say, to go to a hospital. There is a hospital near them, but they cannot go to the hospital because they don't have the means to go there. And I was going to say earlier that this is also another area where the government also comes in. Now you see, in other countries like in the UK, there's what they call the NHS. And that NHS is a form of medical care organized in such a way that it's subsidized for people, first of all, and you have the ability to go to the hospital even if you don't have a dime on you and get treatment. And then there's a way it's gotten from their taxes and all that. If Nigeria can develop something like that, it's going to go a long way to help. And I think the immediate past president, President Buhari, brought in a law that is the National Health Insurance Agency, that tried to expand from the usual, what we have previously had as NHS, to see how they can expand to capture more people in this scheme. It's going to help with these problems because, like you said, it's not just anti-malaria drugs. Now, anti-malaria drugs that were going for 600 naira before are about 1.8 now. That's almost 3 times the price, maybe just 2 years ago. So a lot of people are strained, and for even other illnesses, they don't have the means to take, because prices of things have gone up, the salaries have not gone up. Some people, the stress of going to farm to produce and all, it has not changed. The same thing, but the price of things have gone up. So a lot of people are stretched, by this. So it's at this level, it's just to advise that the government should look for a way of accelerating this NHIA scheme to so much money. Now to also say that it's important that we as individuals dwell more on prevention, because as you can, like you rightly noted, prices of getting these things is up. It's rather to avoid it. That's why we'll keep repeating the issue of prevention over and over and over again, because it's better for me not to have to go to the hospital at all if I can, than to go to the hospital when I don't have the means.
But we'll run you out of business.
No. You see, we as physicians, we as physicians.
That's on the lighter note.
No, I get your point. But you see, people will always be sick, no matter how you do. Of course, and it's not just malaria that is sick. There are so many other sicknesses. You understand? So, but we as clinicians, our primary aim, our oath. One of the things in our oath is that you should do no harm. And what that means is that you should try as much as possible to ensure that the individual is healthy. That is our primary aim. So that is why we emphasize on prevention, especially for those of us that are family physicians. We emphasize on prevention because we discover that it is better to prevent than to treat. Treatment comes at a lot of cost, especially when it becomes complicated. So our emphasis should be on prevention as much as possible. Let's adopt healthy lifestyles. Let's adopt things that will help us to prevent or to coming down with some of these illnesses. Thank you.
Okay. Now, Dr. Obam,
Yes, sir.
your colleague has advocated deepening, accelerating the national health insurance scheme to cover all persons, particularly within our focus of malaria as we are talking about. Beyond the national malaria program, what measures can the government deploy with regards to making accessible the care and management treatment of malaria for as part of strategies for eliminating it, especially now that a task force as well as an advisory board has been constituted by the Ministry of Health.
Okay, thank you. Like we said, it's always pertinent for individuals to have access to these healthcare services. And of course, in our days now, things and times have become so difficult, especially with the dwindling economic situation in the country. So the government should at least ensure that each citizenry have access to these services. Of course, we commend the minister for the inauguration of the board, the advisory, and the task force. Of course, they should be charged to, do the work diligently. Of course, like he also mentioned about insurance. Insurance is also very, 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 very important because a lot of persons find it very difficult to access these services. For those that are civil servants, I think it's always easier for them. But for those that are not civil servants, those that are maybe private citizens that are not working or maybe doing minor business and the rest, the government should also have a way of bringing them into this scheme so that they will be able to access this service. Although there are also informal types of accessing these services to via the National Health Insurance Scheme, or individuals to also coming together like a community, coming together to contribute to a pool, contribute to a coffer that would help them in that community when one is ill. So those measures are very, very important. Of course, subsidizing these services for instance, on the 5, the elderly ones, and the pregnant ones by the government is still possible. If the government of the day could say the under 5, the pregnant women, and the elderly could access these healthcare services free of charge, it's not too much a burden for the government to do. So with all these measures, I think it will be easier for Nigerians to be able to access these healthcare services. Thank you.
Okay, Dr. Dogoh, mother-to-child transmission of malaria, what is the best preventive measure to be adopted?
Okay, thank you. Before I address that question, just to also mention something on the other question you asked about the availability of these drugs in hospitals.
Okay.
The truth is that some of these drugs that are not supposed to be sold are being sold. It's very unfortunate. It's very unfortunate. But I think, like my colleague said,
an example of which is the anti-malaria.
Yes, I'm being very particular about anti-malaria because I'm not. That is one of the major drugs that I know that it are subsidized.
Yeah, because apologies to Burton. In the course of researching for this program, I came across documents that actually specify that some of these essential drugs, like the anti-malaria, antihypertensives, and even the drugs that are meant for cancer care and certain conditions, are meant to be really subsidized because they are considered disease of public importance or so, and the burden it weighs on the out-of-pocket expense.
Exactly.
Which is why I brought that up.
Exactly.
Yes.
So that's like your research is actually true. Yeah, some of these medications are supposed to be subsidized. Some of them are outrightly free, like for the anti-malaria. The Bill and Melinda Gates Foundation was also involved in malaria programs, and they try to see as much as possible to subsidize these medications, like you have with anti-HIV medications. Now, it's unfortunate that in some areas where these drugs are supposed to be free, they are not given free, and that is where government has to put in, to also be more strict with its supervision, so that we ensure that these medications are given to people free. I'm currently doing, supervising a program, a humanitarian program in some of the IDPs, And this issue actually came up, and we discovered that some of these drugs were not given to these people free of charge, as it was supposed to be. And they're in the hospitals. Now, because of it's a ripple effect with the economic issues. Some hospitals are not even able to stock their pharmacies as it should be. So people come and they're not able to access these medications freely. So that is another issue that we have. But it's a cyclical effect, something that it affects. One thing affects the other. But by and large, government should supervise to ensure that these things are done the way they're supposed to be done. Now, back to your question, which I've even forgotten.
Of mother to child,
mother to child
of malaria.
Now,
the strategies for prevention.
Now, the strategies for prevention are basically the mother based.
Sorry.
They are basically the mother based, because the baby is inside. The baby does not know what's happening. It is the mother that has to take the care, and majorly it is via the antenatal, what we term the antenatal care. And even before prenatal care, we have the prenatal, the antenatal, and the postnatal care. At all of these levels, it is important that these things are done. Now, for the prenatal care, you know that if a mother is immunocompromised, she has a higher chance of coming down with malaria in pregnancy. What that means is that the mother needs to take care not to be immunocompromised. The mother needs to take care even before she takes in, to ensure that her immunity is strong. And how is your immunity strong? Balanced diet, exercise, healthy lifestyle. So somebody who is living an unhealthy lifestyle, somebody who is not having enough rest, somebody who is being stressed, somebody who is not eating healthy, is most likely going to come down with malaria in pregnancy during the antenatal period. So prenatally, you have to observe all these preventive measures you're talking about, because if you have somebody that is coming down with malaria all the time before you even get pregnant, there's going to be a high malaria parasitemia in your blood. So you stand a higher chance of coming down with malaria as a pregnant woman. Now, during the antenatal care, we advise that every woman that takes in should attend antenatal care. It is something that we keep saying all the time, and we'll keep repeating it, because it is very, very important. Now, during the antenatal care, that is given to anti-malaria drugs that are given to these pregnant women to reduce their chances of coming down with malaria. My colleague said that malaria itself is an immunocompromised state. What that means is that during the pregnancy period, your ability to be able to muster enough support for your immunity is lower. So this therapy, these drugs help you, help to boost your ability to be able to fight, malaria. So that these preventive measures, such as during the pregnancy period. Of course, that when the woman becomes pregnant, especially when she's advanced, there are a lot of issues. She struggles with so many things. But there are things that you must. That's where the family comes in. That's where the community comes in to be able to support these women so that they don't come down with malaria in pregnancy. Because it is, if the can be done, then after the woman has, even when the period that the infant is small, because we said earlier that these infants are under 5 are the ones that are worst hit. So after delivery, you expect that this child should be sleeping under intestinal treated net. Don't just keep the child to be sleeping in the open. You understand? You ensure that even you, the mother as well, is also staying healthy. Because if the mother falls sick, it's going to affect the care of the child. So these are some of the issues. These are some of the things that should be done in pregnancy to help to prevent this malaria between the mother and the baby.
Okay, Dr. Obam, is there something you would like to add to this concerning mother-to-child prevention of malaria?
Okay, like he said, the pregnant woman is advised to always commence antenatal care. And to add to it, even at the level of a primary health care center, the antenatal services are rendered there too. So an individual shouldn't say that I'm not being able to access a general hospital, a teaching hospital, or a federal medical center, so I should stay at home. No. Even the closest primary healthcare facility can offer these services to this individual. So the individual is advisable to seek its services there, so that the child and the mother will be prevented from having malaria, because there are attendant consequences that will come from malaria are numerous. It ranges from anemia to even the loss of that pregnancy, which is and even of course, maternal death too can occur from malaria. So we need to prevent them, and preventing it is by assessing these facilities, these services in these facilities, and of course, personal hygiene, clearing, environmental sanitation, clearing of bush around the houses, and the support too is very, very important, just like I said, because I don't expect a pregnant woman to go and be clearing the grasses around the house, or maybe doing much of the cleaning and the rest. So she needs support from the husband, the immediate family, and as well the community, so that the pregnancy will, around is good cause, and we will now give birth to a very healthy child, and also have a very strong mother at last. Thank you.
Okay, Dr. Dogoh, when we discuss all of this here in Benue, there is a category of people that we often not we ignore. The persons who at the moment, some of our brothers and sisters, as fathers and mothers, who are taking refuge in the internally displaced persons camps. With the situation of the rains being here, some of them are in shanty locations. What measures can the government and even the people, the IDPs, adapt with regards to keeping themselves away from coming down with malaria as well as cholera?
Okay, thank you very much, Mr. Nathaniel, for that question. Now, the most important thing to do for the people that are in IDP camps is to return them to their homes, which I think is long term, but I think it's something that government should look critically at and try to ensure that they do it as soon as possible, because many of these people have been in camps for years, and of course, because of some of them have been displaced because of insecurity. So security situation should be addressed headlong. I usually wonder why it's become so difficult. Maybe the security experts may explain better why it has lingered for so long. But government should be able to resolve this and to resettle these people back to their ancestral homes. Because when you are at the mercy of others, there are certain things that it becomes much more difficult for you to do. For instance, let me give you an example. If somebody is in an IDP camp, you know that feeding becomes a problem, especially if he has to rely on the donations and support of outsiders. Whereas if he was in his place, he can source for his food by farming, fishing, and hunting and all that. So these are issues. However, for the measures that should be taken, they are still similar to what we have said. If you go to some of the IDP camps, because I've gone to a couple of them around Makurdi, Guma, Axis, some of them actually were organized, clean to a large extent, whereas some of the camps, they are not clean at all. They don't look very kept. They look unkept. There was a camp I went to the other day. There's a big gutter in the camp, that is with a lot of water in it. It's not flowing properly. So those kind of issues, even for the people that are in the camp, they still need to clear these stagnant waters. They still need to keep the environment clean. And as much as it's possible with government, to also try to assist them with feeding. Because some of you, like we said, we talked about immunocompromised individuals. If you're not feeding properly, you stand a higher chance of coming down with malaria as compared to somebody who is feeding well. And then, of course, it's important that everybody that is in these camps has an insecticide-treated net. So if this net can be supplied to them, it also go a long way to help them, to prevent this malaria. And then if the government can assist some of them, because some of these people, they are living buildings that they can stay in, because some of these places you go, they are those emergency constructed things. Some of them are leaking. Some of them they are open. They don't have closed doors, so there's free flow of mosquitoes in and out and all that. So if the government can look into this to help, because the truth is that many of them don't have the means to sort themselves out when it comes to shelter, and some of them are even struggling with feeding. When you go to these camps, so a lot of them have not even eaten. Some of them eat once a day. You understand? So these are things that I think the government can can help. And then the IDPs themselves, it is important for us to educate them on personal hygiene.
Yes, which is
Yes.
the center of it.
Exactly.
Yes.
It's possible that it's important that we, and that is where this advocacy and health education and promotion comes in. If the government can arrange and sponsor campaigns to this camp where we can speak to them. Of course, I know that there are a lot of different groups in this camp, non-governmental organizations. The government also has from the emergency board, a lot of people that are in the camps that are doing this. So these are the areas that they should also emphasize. Personal hygiene. The fact that you are in the camp does not mean you just leave yourself to be unkept, because there's water in the camps. Most of the camps have water. So basic fundamental washing of hands, basic fundamental washing of your clothes. Even if you don't have soap to wash, put it in water and squeeze it and dry it. If you sun dry it, it will go a long way to help. So you not just say, okay, because I'm in the camp, I don't have soap. You just, no. You take your bath. Clean your environment, even your wherever you are staying, make it clean. Make sure that this environment you are staying does not have refuse dumped around it. At least it's clean, does not have unnecessary crevices where things can hide. That will also go a long way to help the people in the camp. And then also psychological encouragement and motivation, because some of these people are having a lot of challenges psychologically. Some of them are into depression. Imagine you have been chased away from your ancestral home, you are living at the mercy of other people. So by encouraging them psychologically, that will also go a long way to boost their self-esteem.
Okay.
Also go a long way to boost even their ability to take care of themselves.
With that caller. Okay, the line is still open, and the line is 0814-335-9292. 0814-335-9292. Good morning.
Good morning.
Thank you for joining us.
Yes, the voice of Mark Anwanji, the father from Sierra.
Okay, Mark, make your submission.
Thank you so much. The discussion this morning is very, very interesting. You know, I will first start from the caregiver. The issue of malaria and cholera, I think, is a deadly disease, most especially children under 5. So, government is trying its best. So, make with the individual put our hands together by giving compliance. What I mean is that this breakthrough malaria program, I think they did a lot for affiliation with the Nigerian government. So there's some volunteers that are being moving from community from one house to another to issuing the referral card, only for the caregivers or parents to carry their children with the malaria symptoms to go to our health facility to correct the ACT. They find difficult. I was one among the participants. So we come to discuss that sometimes we go and refer children to go to our health facilities, and the parents keep those cards at home without giving compliance. It is very, very unfair. And the government provided us a lot of mosquito nets. There was a huge amount that money that the government spent by providing mosquito nets for us. It's only for us to use it judiciously, and we are diverting it for other purposes. With the plant water, I believe that the mosquito accumulated.
I only want to advocate to people. Like I had a case with one of those participants sharing anti-malaria. The girl was actually forging figures, and at the end she discarded the drug.
Forging
figures. Yes.
Figures
she's supposed to take data.
Yes.
Supposed to take data and share the anti-malaria for children.
Okay.
No.
Yeah, it was a federal government initiative. The girl forged data and discarded the that she could not, that she don't want to work, but she collected the pay. Mosquito net, she was just sharing people within her community instead of her to go to the field and share to the concerned people. So I think even a personal, what will I even say, equally.
Such things, Dr. Obam.
Yes, sir.
Of course, let me allow you both to react to that. It means government on its part may have been attitude and get the people doing the correct thing that will keep them healthy, away from malaria.
Yeah, at least I'm aware of government interventions when it comes to malaria, because I've had a cause to engage in some training. At least since I joined the civil service, I've been trained on malaria. So the government is really trying on its part, and just like the other caller has said, a lot they divert it for other things to health education. A lot very important for them that we have been preaching against here are not supposed to be. Of course, there are some that even when you give them these tablets to take them becomes a problem, and someone somewhere is subsidizing this.
Gabriel from Ejakpama, Doctor.
Okay, Ondachi, please make your submission very briefly.
Thank you. Very brief, of course. My regards to the guests in the house. Staff. In fact, our people are very, very hard to deal with. If they say that something is bad, and you know that it is bad, you still do that thing. The government, the federal government, both the state and federal government have done a lot to save our people, even if it is God that is saving. But when you are saving yourself, God saves you more. Yeah. When they say you do this, like the net they distributed, they only give them to the okra in the farm, the backyard, yes, where they have their small farm. It is not even fair for them. The campaigning is done. Agate Radio is doing every day. I thank them for that. And many other people are doing it. The agents are also doing it. So I still urge them to continue, that they be free from God's mouth. Thank you.
Thank you very much, Ondachi Gabriel. We appreciate you. And that will be the last call we accommodate on the today's edition of the program, the one from Ondachi Gabriel. Okay, Dr. Obam, I'll allow you to conclude your thoughts on how people can change their attitude and embrace some of the government intervention as what the donor and development partners are doing with regards to stemming the tide of malaria.
Okay, well, like I was saying,
yes,
character change, mindset change is very, very key. And of course, at the level of the government and health workers, we cannot relent, but always continue to, educate the populace, to tell them, teach them on these, all important attitudinal change, because it's very, very important for Nigerian citizens to have this change. And it cut across not just Benue State, almost all the states in Nigeria. You get this insecticide treated net, you use them for other things, then you come down with malaria. It's really not important. And again, even if these mosques and all these marketplaces, it's very key. And when this information is passed to them repeatedly, without being tired about doing that, I think with time they will be able to adopt most of all these attitudes. It's not just for malaria. It's not just for malaria and cholera. I think it's a holistic problem. The attitude of a Nigerian to illness is always the same, and it's always good for us to change those attitudes.
Dr. Dogoh, on the part of you medical professionals, as professional associations, what kind of special interventions beyond attending to people in the hospitals, what kind of special interventions are you offering to citizens, especially those at the grassroots, to sensitizing and also tame the burden of malaria and cholera?
Thank you very much. I want to.
This will be your concluding thoughts.
Okay.
In a minute.
I want to first appreciate the callers. They brought a lot of perspective to our discussion that I think is very, very
perspectives
important.
Perspectives.
Exactly.
That's where the program derives its name from. That actually.
Yeah. So yes. Mr. Mark, talked about the chemoprophylaxis that is going on. And I think I'm happy that he brought it up so that it creates an awareness for those that don't know. Yes. There's a program that is going on currently. That's giving, because of this is a period that is a high burden of malaria, and I want to appreciate him for that. Also, my very good friend and colleague that give us an insight into mosquito nets to people,
drugs,
or anti-malaria drugs to people, and then you corner it, you don't share it. First of all, go beyond our primordial interest to see how we can help our people. That is why we are here. And government on its part should also put in a lot of energy to supervision, so that when somebody is supposed to do something, the person does it. Because obviously government has done a lot, but unfortunately because of cultural, issues and lack of commitment, some of these things have not reached where they're supposed to go. However, in answering your question as per the issue of the unions and healthcare workers and what we need to do, first of all, we need to be faithful. Let me start from there. Where there are issues where we need to, government commits things to we should be seen to be faithful in carrying out our work, our job. We should not be seen to be cutting corners. We should not be seen to be diverting, things that should help other people. Then from our perspective as well, celebration, the Malaria Day, there were programs that we organized. NMA as well organized a program, in conjunction with M1 in IDP camps, malaria and cholera.
Commend the leadership of the Nigerian Medical Association as well as the Medical Women Association of Nigeria for always organizing such programs and the citizens of Benue State and Nigeria for today.
Okay, dear listener, this is where we draw our curtains on today's edition of Perspectives, which we discuss the Dr. Fanen Dogoh. Thank you very much for sharing your time with us on Perspectives.
Thank you for having me.
The Registrar, Department of Family Medicine, also at the Federal Medical Center, Makurdi, Dr. Emmanuel Obam. I appreciate you for your time.
Thank you very much, sir.
Stay healthy. So